Hello, everyone. My name is Gabby, and I work at Shatterproof. We are a nonprofit that is committed to ending the addiction epidemic in the US, and one of our specialties is focusing on addiction stigma, so that's what we'll be talking about today. So first, here on this slide, we have 3 buckets of stigma here. At Shatterproof, we talk about 4. The first is public stigma. With public stigma, we're talking about society's negative attitudes towards a group of people, where we can create environments having individuals feel unwelcome, judged, or blamed. Another part of public stigma that we talk about is stigma against medications for opioid use disorder, or MOUD, also referred to as MAT, or medication-assisted treatment. And this is really the idea that some types of treatment or recovery carry more stigma than others, and certain ones might be deemed more acceptable to certain people. So it's part of public stigma, but we do separate that out specifically as well. Next, we have structural stigma. When we're talking about structural stigma, this is systems level discrimination, and it can either be caused by institutional policies that are codified and written down, maybe something in an employee handbook or the way a certain department might run. But it can also be affected by dominant cultural norms or status quo, so things that people tend to do or follow despite the fact that they might not be written down or official. And then lastly, we have self-stigma. This is where an individual take that public stigma and that structural stigma and face it inward, and they start to accept societal stereotypes about themselves, and it can lead to a reduction in self-esteem and self-efficacy, both of which are crucial if we're talking about treatment or recovery, so we need to be mindful of that. But overall, any type of stigma manifests as discrimination, and it can dictate how policies are created, how healthcare is provided, or if it can be accessed, and how people perceive treatment, if they know about treatment, or even if it is offered, and overall can lead to feelings of exclusion and shame, as well as negative health outcomes. We're talking about stigma and the healthcare setting specifically. While today we're going to be mentioning a few individual level changes that you all can make to better support your patients and provide better patient outcomes, I do like to highlight that the system is not designed to support individuals with SUD. While in the last decade or so we have seen major progress in this area, you all as providers also deserve more support when interacting with your patients. So we do like to highlight that. So again, a lot of what we'll talk about today is more on that individual level, but we do need to see that system change in order to have true progress. But the reason that we will talk about this individual level change specifically around language is because we have seen that exposure to stigmatizing language, either in a patient's notes or when we're talking from one provider to another, has been associated with more negative attitudes towards the patient and with less aggressive management of that patient's pain. And while any person with a substance use disorder will face a level of stigma, we also like to highlight that other stigmas can be compounded and affect access to treatment and care when we're talking about other identifiers of a person. So here we highlight race and ethnicity. We're talking about Black, Indigenous, and other communities of color. But this is also true based on sex, gender, orientation, a physical appearance, any other characteristic of a person that could add stigma is something that we want to be mindful of as well. But a silver lining here is that attitudes towards individuals with SUDs was found to be improved after taking online training modules. So that's something at Shatterproof that we do through our state campaigns, and we've found success with. So on this slide, we're talking about an example of how we know that words shape the way we view people and how we treat them. And there were 500 clinicians split up into 2 different groups. They were completely randomized and everything was kept the same, minus the term that they were asked to use either when talking to their patient or when sharing information about that patient or writing in their notes. And the first group was asked to use the term or phrase individual with substance use disorder. Here we're using what we call person first language. So we are highlighting the fact that they're an individual first and foremost. This might seem a little bit obvious, but really it's a way to highlight their humanity, that they are deserving of respect like any other person. And then we do acknowledge the substance use. However, we're saying substance use disorder. So more aligned with medical terminology, and that it is deserving of respect and care and treatment, just like any other medical condition, such as heart disease or diabetes. And then the second group was asked to use the phrase substance abuser when referring to their patient. And here we're taking out that person first language. The only way that we are referring to that person is in relation to their substance use. And it's with that phrase abuser. That is the main way that we are labeling them. And it was found that clinicians were more likely to say that their patient was personally responsible for their illness and to support punitive action over treatment when they use the term substance abuser. So again, whether it is conscious or not, the phrases that we use and the stigmas that they carry really can impact the way we interact with our patients and how we suggest treatment happen. So something to be mindful of. But on this slide, a great way to counteract that is by looking at Shatterproof has a language guide. Other organizations have them as well, but it's a way to really be mindful of the language that we're using and seeing where we can use less stigmatizing terms or phrases. So on this slide at the bottom, you'll see an example. Dirty or the term clean are pretty common phrases that we might hear in relation to substance use, especially when we're talking about tests or use in general. And instead of using those phrases, it is recommended to say person who tests positive for substance use or test negative, or a test that comes back positive or negative. And this is really because the terms dirty and clean are associated with filth and not a medical condition. So we first really want to enforce the idea that the substance use is a medical condition. And then we also want to avoid that bias and shame that comes from some more stigmatizing language. But this resource will be linked towards the end of the presentation, and you can always reach out to us at Shatterproof if you have any more questions. On this slide, you'll see a Venn diagram where it really helps us highlight the idea that as we are asking you to make these changes in language, you still might hear your patients use terms that we have mentioned as carrying more stigma, such as addict or abuser. But we really don't want to make our priority to change the language our patients are using. Instead, we want it to be about monitoring the language that we use with our patients or with other healthcare professionals and using less stigmatizing terms there. And again, this is because we know that the language we use can affect how we view people and also the type of care we provide them. But we don't want to be correcting our patients' language because we do want them to feel comfortable sharing things with us, that we aren't judging them. So we do want to be mindful of that as well. And just a quick recap. So what can we do? The first thing, especially on that individual level, is adjusting our language. So again, you can review the Shatterproof language guide. You can reach out with questions, but being mindful of the terms we use and the stigmas that they carry really is the main way that we can make change. Secondly is learning the facts. So attending webinars like these, again, checking out Shatterproof resources or other resources that you can find through this presentation or through Quality Insights. We also want to be supporting our families, friends, and communities. By doing this work, by changing our language, it really allows us to see the whole person, no matter who we're speaking with or to. And because of all those stigmas we've already talked about, we really don't know, or we might not know what someone's relationship is with substances or with substance use or substance use disorder. So this work really goes beyond the professional setting and beyond our work with our patients and has reverberating effects throughout our communities. In that vein, we want to also make sure that we're listening to people when they're sharing their stories with us or when they're speaking with us. So this is both verbally, maybe repeating back what they say to us to confirm we understand, or even just simply, saying yes, or, as we go through, but also physically as well, being mindful. We might not even realize it, but we could be standing further away from a patient than we might be with someone because we know about their substance use disorder, or maybe we're crossing our arms. This is feedback that we've gotten from people with lived experience as they interact with healthcare providers. So also something to be mindful of as well, our communication, both verbally and physically. And then lastly, which is sometimes the most challenging, is to speak out when we hear something stigmatizing. This is really important to confront misconceptions and stereotypes. And this does not always have to be something that's confrontational. It could be as simple as if someone, mentions to you a test came back dirty, or you see that in a note, kind of just correcting, or also making note like, oh, it came back positive. Thanks for sharing. So just really emphasizing the less stigmatizing terminology is a great way to combat that. And then lastly, do want to share and highlight some work that we do in the state of Pennsylvania as a whole. Our state campaign in PA is Life Unites Us. This campaign helps fight addiction stigma across the state. And here on this slide, you can see an example of what you would find on our website. This is our story library. This gives a platform to residents affected by the addiction pandemic or epidemic, excuse me, and it highlights a need to replace stigma with support and understanding. So here, by listening to people's stories, again, we really want to emphasize the idea that all of these people are deserving of humanity and respect. And when you are checking out this site, you won't just find people with their own personal lived experience, but we also have talked to loved ones or caregivers, also EMTs or healthcare providers. So we have a wide array of experiences here that can be learned from, and we really appreciate those who share their stories with us. And again, if you do have any questions, please feel free to reach out to me or anyone at Shatterproof.